So hello students. So last class we discussed about the basic physiology of cardiovascular system. So today's class we will discuss in detail about hypertension. So hypertension is what? So hypertension is a condition where your blood pressure increase more than more than 140 by 80 mm of Hg. When this increase 140 by 80 mm of Hg, this condition is called as hypertension. So hypertension can be calculated by a simple formula, that is blood pressure is equal to cardiac output into peripheral vascular resistance. Okay, so blood pressure is equal to cardiac output into peripheral vascular resistance. So what is cardiac output? So cardiac output is the amount of blood that comes out from the heart per minute. In a minute, how much amount of blood come out from the heart, that is called as cardiac output. And cardiac output is a multiplication of heart rate and stroke volume. Heart rate is, you know, that there is a 72 beats per minute into stroke volume. Stroke volume means at each contraction of ventricle how much amount of blood will comes out, that is called as stroke volume. So if we will calculate, so uh, if we will calculate that we have 72 beats per minute. If 1 ml blood is out in a single stroke volume, so total is equal to 72 ml is your cardiac output. Okay, so next one is peripheral vascular resistance. So what is peripheral vascular resistance? To understand what is peripheral vascular resistance, let us draw a blood vessels. So this is a blood vessels. As I discussed with you in all autonomic nervous system, blood vessels have two type of receptor. One is alpha 1, second one is beta 2. Alpha 1 will always cause vasoconstriction and beta 2 will cause vasodilation. If, let us assume, if the alpha 1 is stimulated, so more vasoconstriction will occur and it will causes increase in blood pressure. Okay, if we inhibit the beta 2 receptor, there will be what happens? There will be abnormal vasoconstriction, because vasodilation, if we will block the vasodilation, so vasoconstriction will occur, and this vasoconstriction can also leads to increase in blood pressure. So I explain you how cardiac output and peripheral vascular resistance increase the blood pressure. Next, this is before going to this classification, come to this slide. So how the blood pressure basically increase? So if we discuss about the brain, our brain have, our autonomic system have sympathetic system. Okay, sympathetic system. You know that when the sympathetic system activated, it will release catecholamines like adrenaline, noradrenaline, norepinephrine type of compound will release. So this compound will binds to, if we talk about adrenaline, adrenaline will binds to beta 1 receptor in heart, and it causes increase in heart rate and cardiac output, that ultimately increase your blood pressure. Adrenaline also have activity in alpha receptor, so it also binds to alpha 1 receptor. And you know that I just told you alpha 1, when alpha 1 receptor activated, what will occur? Vasoconstriction. Okay, vasoconstriction will occur, and this vasoconstriction will leads to increase in blood pressure. This is one mechanism how blood pressure increases. Let us discuss the second one. So to understand the second one, you have to assume two conditions. Your blood pressure is decreased than the normal and your blood volume also decreased than the normal. Okay, so what will happen? You have two bean shaped organ that is called kidney. Kidney will immediately release an enzyme called renin. Okay, you know, liver. Liver had liver release a synthesize a compound called angiotensinogen, and we see it is basically inactive compound. And what renin do is renin convert angiotensinogen to angiotensin 1. Renin convert angiotensinogen to angiotensin 1. Now this angiotensin 1 is unstable. So what it will do is angiotensin 1 always try to convert to its stable form, that is angiotensin 2. Okay. In the presence of an important enzyme, angiotensin converting enzyme. Remember this enzyme we have to discuss in detail later. Okay, now this angiotensin 2 that synthesized here have three major role. Okay, three major role. First one is it causes cardiac remodeling. Second one is it causes vasoconstriction. Third one, it causes aldosterone release, and this aldosterone will retain sodium and water, and ultimately it causes, these three ultimately causes increase in your blood pressure. Okay, so now we will discuss about targets. So what are the target we can block? First is we can block the release of adrenaline, noradrenaline, norepinephrine. First target. Second target is we can block beta 1 receptor in heart. Third target is we can block alpha 1 receptor in blood vessels. We can block the release of renin. We can block the conversion of angiotensin converting enzyme. So after conversion of angiotensin 2 will binds to two major receptor, AT1 and AT2 receptor. These two receptor will binds and the ultimate activity will occur. So we can block this activity, this binding of AT1 and AT2. And we also, as we know that due to sodium and water reabsorption, edema will occur, and edema also contribute to blood pressure. So we can block the sodium water reabsorption by class of drug that is called as diuretics. Now you comes to this classification. So if we talk about this classification, first class is angiotensin 1 angiotensin converting enzyme inhibitor class of the drug, that is captopril and lisinopril, enalapril, ramipril, benzapril, enalapril. You have to remember that all the ACE inhibitors are prodrug except CL, captopril and lisinopril. Then angiotensin receptor blocker, telmisartan, losartan, candesartan, irbesartan, azilasartan and valsartan. Okay, next is direct renin inhibitor, that is directly inhibit the release of renin, that is aliskiren, ramikirin and enalakirin. Then central sympatholytics drugs are clonidine and alpha methyl dopa. In case of beta blocker drugs are propranolol, atenolol, metoprolol, carbidelol, nebivolol. Alpha blocker prazosin and terazosin. In case of diuretics, drugs are thiazide diuretics, loop diuretics and aldosterone antagonists. You have to remember one point is thiazide diuretics are first line agent in hypertension. You have to remember this point. This is very much important clinically. ACE inhibitor also first line agent in hypertension, but except it is contraindicated in renal artery, renal biliary artery stenosis, renal biliary artery stenosis. It is contraindicated in this class. Okay, then calcium channel blocker drugs are nifedipine, amlodipine, nicardipine, nimodipine. Then in case of vasodilators, drugs are arteriolar dilator hydrolazine, minoxidil digoxide, arteriolar plus venous dilator is nitroprusside. One point you have to remember that sodium nitroprusside is used in hypertensive emergency. This dioxide is very much important every time question asked because it is a thiazide analog. Question will ask like which thiazide analog or thiazide like diuretic analogs are the used as a vasodilator. So your answer will be dioxide. Next, so let us discuss in detail about ACE inhibitor. So ACE inhibitors are the class of the drug that basically inhibiting the ACE enzyme, that is it basically blocks the conversion of angiotensin 1 to angiotensin 2. These are the first line agent but except is bilateral renal artery stenosis I told you before. In this condition, ACE inhibitors are contraindicated. Other than this condition, these drugs can be given. Even though ACE inhibitor and diuretics, thiazide diuretics are given because it show synergistic activity. So teplotide is the first ACE inhibitor that approved clinically. Let us discuss about captopril, which is a prototype drug, which is not a prodrug, it is an active drug because I told you all the ACE inhibitors are prodrug except captopril and lisinopril. Every time question is asked from this. Okay, this is a sulfahydryl containing dipeptide. It is a sulfahydryl containing dipeptide. Okay, it can causes hypotension by decreasing total peripheral resistance or peripheral vascular resistance. It basically acts to your TPR, total peripheral resistance, ये decrease कर देता है. Okay, so ultimately what it is called, it will decrease both your systolic and diastolic pathway, your whole BP will be reduced. So to remember its adverse effect, you have to simply remember a mnemonic, that is had TRP receptor. H for hyperkalemia, H for hypotension, headache, then A for acute renal failure, angioedema and cough. Okay, so cough is bradykinin is a autocoid. Okay, so ACE inhibitor prevents its degradation. So if its degradation is prevent, its level ultimately increase. When its level ultimately increase, it leads to cough. Okay, what it leads? It leads to cough. Okay, cough and angioedema. So it is a typical side effect and also it is, remember, it is important from the exam point of view. Okay, other than that, rashes, dysgeusia means a change in your taste. Change in taste. Okay, then teratogenic proteinuria and granulocytopenia. So if we'll talk about its drug interaction, you can remember by mnemonic KIA. Okay, so as you know that potassium sparing diuretics are the diuretics which basically consume or uh, reabsorb the potassium, and ACE inhibitor the diuretics ACE inhibitors are also showing hyperkalemia as its side effect. So when they combine, severe hyperkalemia will occur, that will leads to different type of arrhythmia. Okay, next, antacids decreases its bioavailability. ACE inhibitor reduces its lithium clearance and increases toxicity. When you combine with indomethacin, as you know that indomethacin increases sodium and water retention. That's why it decreases its potency, and additionally renal failure can be potential. This question is asked in NIPER 2023. this year only. Okay, so if we'll talk about its uses, you can simple remember by mnemonic MDH. You know that MDH masala is one of the famous brand in India. MDH spices, MDH spices causes cardiovascular disease problem. So you can remember by this. M for myocardial infarction, it can use in myocardial infarction. D for diabetic nephropathy. H for hypertension. S for scleroderma crisis. Causes C for CHF. CBD cardiovascular prophylaxis. It can also use in cardiovascular prophylaxis. So if we'll talk about angiotensin receptor blocker, these are basically block the 81 and 82. Majorly it blocks the 81 type of receptor. Majorly it block 81 type of receptor. Majorly it block your 81 receptor. Okay, so if we'll talk about drugs, losartan, it is a competitive antagonist and inverse agonist. Inverse, not inverse antagonist, it is inverse agonist. Okay, it is mild uricosuric property. It has the active metabolite L3174. So it is important question you may find from this metabolite. Adverse effect is hypotension, hyperkalemia, teratogenicity, headache and dizziness. So it can use in hypertension, diabetic nephropathy, congestive heart failure, myocardial infarction. So if we talk about some special points, irbesartan have highest oral bioavailability. Olmesartan is a prodrug. Telmisartan is not a prodrug, though it is dose given in 20 to 80 mg once a day. Okay, so let us discuss about diuretics. So diuretics are the drug that basically eliminate your sodium and water from your body, and that will ultimately result in correcting your edema condition. Okay, so thiazide diuretics are frequently used in the management of your hypertension. So if we talk about loop diuretics, it is basically block your sodium potassium 2 chloride. Loop diuretics are also called as high ceiling diuretics or high efficacy diuretics because it has higher activity than as comparison to other class of drug. So it is major side effect associated because question always asks from side effect. Major side effect is hypokalemia, erectile dysfunction, hyperglycemia, hyperlipidemia, hyperuricemia, hypocalcemia and hypomagnesemia. If we talk about aldosterone antagonist, so spironolactone is one of the important drug comes in this class. It is a prodrug and it convert to its active metabolite carnion. So what it is basically do? It basically inhibit the sodium and water reabsorption in collecting duct cells. Which part of the nephron? That is collecting duct cells of the nephron. Okay. Rather than its spironolactone, its active metabolite carnion has longer duration of action. So if we talk about uses, edema, hypertension and congestive heart failure. One point I have to add here is it reduces mortality death rate. It reduces mortality rate in congestive heart failure patient. It is very much important. You can get a question from here. Okay, then if we'll talk about its drug interaction, hyperkalemia with potassium supplements, aspirin blocks the spironolactone activity by inhibiting its tubular secretion. Hyperkalemia with AC inhibitor and angiotensin receptor blocker, it interaction with plasma digoxin level. Okay, if we'll talk about its side effects, so gynecomastia is the important side effect which is associated with spironolactone, and this year also we got a question in NIPER about gynecomastia. Which of the following diuretics causes gynecomastia as a side effect? Loss of libido, acidosis, peptic ulcer, and it is contraindicated in pregnancy. So as I told you, thiazide is a first line agent that act inhibiting sodium chloride transporter. Okay, so it is basically reduce your total peripheral resistance by inhibiting the sodium absorption. Okay, so its major side effect is hypokalemia, hypercalcemia. In case of loop diuretics, you find hypocalcemia. In case of thiazide diuretics, you will find hypercalcemia as a side effect. Then erectile dysfunction. Carbohydrate intolerance, hyperlipidemia, and hyperuricemia are the major side effects that found with thiazide diuretics. So let us discuss about beta blocker. So as I told you, beta 1 is the major receptor for increasing blood pressure. Other than the beta 1, beta 2 also, as I told you, beta 2 is responsible for vasodilation. If you block the beta 2 receptor, that also leads to development of blood pressure. So beta 1 is directly increasing the blood pressure. So if we talk about the classification of beta blockers are basically three types: without intrinsic activity, with intrinsic activity, additional alpha and beta blocking activity. Without drugs are timolol, sotalol, propranolol. With intrinsic activity, pindolol. With additional alpha blocking activity, labetalol and carbitalol. So let us discuss about cardioselective. Cardioselective means these are basically block this beta 1 receptor because beta 1 receptor is selectively present in our heart. So drugs are metoprolol, esmolol, atenolol, bisoprolol, betaxolol, celiprolol and nebivolol. So if we will talk about its pharmacological action by taking propranolol as an example, CPS in cardiovascular system, it decreases heart rate and force of contraction I discussed previously. In respiratory tract, it increases the bronchial resistance. Okay, that leads to development of asthma. Okay, it has potent local anesthetic activity, metabolic activity. It inhibit in lipolysis and increase free fatty level. So hyperglycemia is the one of the cause. In eye it reduces intraocular tension and it is effective in, that's why it is effective in glaucoma. So timolol is one of the important drug that is used in glaucoma. Uterus, it causes relaxation, is blocked due to isoprenaline and selective beta 2 agonist. So if we'll talk about its drug interaction, additionally it is additional depression of SA and AB node with digitalis and verapamil due to cardiac arrest. Then warning symptom of hypoglycemia. What is this? Basically, if we will give uh, if a person is suffering from blood pressure, and for example a person is suffering from BP and diabetic mellitus. Okay, so you are, for suppose you are administering insulin. Okay, so as you know that if you will administer insulin, so major side effect will be hypoglycemia. So hypoglycemia when occurs, it will show some symptoms like tremor, sweating, uh, such type of activity, such type of adverse effect you will find, that is the symptoms of hypoglycemia. Beta blockers will block all the symptoms of hypoglycemia except sweating. So that's why whenever you a person finding you found that that person is with insulin therapy and with beta blocker and it is having severe sweating, you have to confirm, you have to sure about that person is suffering from severe hypoglycemia. You have to administer glucose. So indomethacin and other NSAID can attenuate the antihypertensive action. This question also asked this year in hyper examination. Okay, cimetidine inhibits metabolism. Its metabolism lidocaine metabolism is reduced due to propranolol. Propranolol can increases the bioavailability of chlorpromazine by decreasing its fast metabolism. So what are the adverse effects? Adverse effects are bradycardia, hyperglycemia, hyperlipidemia, attenuate the congestive heart failure, and MI worsening the chronic obstructive pulmonary disease as it is causes increases the bronchial secretion. Okay, next, if we individually talk about that beta blocker, I have to discuss the important one. So Stimolol is the shortest acting beta blocker having rehab less than 10 minutes. It is also given in supraventricular tachycardia. It is a class 3 antiarrhythmic drug. Class 3 having class 3 as well as class 2 activity. Okay, so atenolol is cardioselective. Okay, sotalol is a non-selective with low lipid solubility activity. Timolol is topically used in glaucoma. Nebivolol with NO releasing property. Okay, so carbidolol and labetalol is having both alpha and beta blocking property. Additionally, it has a antioxidant property. It is having antioxidant property. Labetalol having both alpha and beta blocking property. If we will talk about alpha adrenergic blocker, it is having both selective and non-selective. Okay, So alpha adrenergic phenoxybenzaimine is a non-selective alpha blocker which is used in hypertensive cases due to pheochromocytoma. Pheochromocytoma is a tumor of your adrenal gland का ये ट्यूमर है. Okay, so phentolamine is a drug of choice in hypertensive emergency and tolazolone is a used in Cheese reaction. Okay, I will discuss in detail in central nervous system. So let us discuss about selective alpha 1 blocker. In case of selective alpha 1 blocker, prazosin is the important drug. Okay, it basically reduces your total peripheral resistance. It is what is the advantages of alpha 1 blocker? It having absence of carbohydrate metabolism, lack of hyperlipidemic action. It is, that means it show positive activity in uh, uh, atherosclerosis. Symptomatic increase in symptoms of benign prostatic hyperplasia. It also increase the symptomatic treatment in benign prostatic hyperplasia. Okay, so if we'll talk about its adverse reaction. So postural hypertension is the most important. It is also known as fast dose phenomenon. When you first time administer this drug, severe fall in blood pressure due to change in posture, that is called as postural hypertension. Dry mouth, nasal blocking, palpitation and blurred vision as the important side effect associated with this. Okay, so if we talk about vasodilators, so vasodilators are the class of the drug basically dilates your arteries and your veins. Okay, basically block your arteries and veins. Okay, so these are the drug basically act by opening of your potassium channel. Four major mechanism: releasing of NO, releasing of NO मतलब nitric oxide, blocking of calcium channel and agonistic action at dopaminic receptor. So its इनका major side effect क्या होगा? The major side effect associated with this class of the drugs are reflex tachycardia, okay, fluid retention. These are the major side effects associated with this. A major adverse effects are tachycardia and headache. So let us discuss about potassium channel opener. So potassium, in case of potassium channel openers, so hydrogen minoxidil dioxides are found. Hydrolyze is basically opening the potassium channel and releasing NO. Both activity it has. The question will be asked, which potassium channel inhibitor having NO releasing property? Your answer will be hydrolyze. Leads to causes vasodilation due to release of endothelium. Due to release of NO at the endothelium. Due to release of NO at the endothelium. It is metabolized by acetylation. That's why and it's a major side effect associated with this is systemic lupus erythematosus. Minoxidil is a prodrug. It is converted to active metabolite minoxidil sulfate, which is basically converted by phase 2 metabolism. It basically act by opening of potassium channel. It causes abnormal growth in female. That's why it is used to treat male pattern of baldness. Okay, dioxide, as I told you, it is a thiazide derivative used as a vasodilator and major side effect is hyperglycemia and hyperuricemia. If we talk about NO releasers, so sodium nitroprusides is one of the important class of the drug which basically act by inhibiting hypertension used in hypertensive emergency. Okay, these three class of the drug basically blocks only artery. Okay, sodium nitroprusside block both artery and veins. Used in these NO releaser basically act by increasing the level of cyclic GMP. Okay, so if we talk about dopamine agonist, so phenol is the drug which is basically so D1 agonistic activity that dilate the peripheral blood vessel that decreases basically total peripheral resistance. So calcium channel blockers are basically L type of calcium channel blockers are present in your heart. These are basically uh, given in the supplement combining with other class of the drug like ACE inhibitor and diuretics. So these are basically block your L type of calcium channel present in your blood vessels and heart. So phenylalkylamine derivatives is verapamil, benzothiazepine is diltiazem, dihydropyridines are nifedipines, nicardipines, nimodipines, isradipines and amlodipines. So the major problem associated with this is basically causes vasodilation and decrease in the activity of heart. So basically it reduces your heart rate, AB conduction and contractility. Okay, so if we discuss more about this class of the drug is the major verapamil is a drug basically causes cardiac depression. Okay, verapamil may causes cardiac depression. So major problem associated with amlodipine is reflex tachycardia. Okay, reflex tachycardia, ankle edema. So these are the major side effects that we found with this class of the drug. Okay, so next is hypertensive drug that is safe in pregnancy. Okay, as you know that several drugs having side effect that they can causes damage, so teratogenic effect. So if we can remember by mnemonic, better mother care, better mother care during hypertensive pregnancy. Remember this mnemonic. Now I am telling the drugs name. B for beta blocker, selective beta 1 blocker, the atenolol class of the drug. M for methyl dopa, alpha methyl dopa, we can precisely call alpha methyl dopa. C for clonidine. Okay, then again D for dihydropyridine class of the drugs, that is dihydropyridine, hydropyridine class of calcium channel blocker, that is your amlodipine, nicardipine class of the drug. Again hydralazine and selective alpha 1 blocker, that is prazosin. So these class of the drug basically given during the pregnancy. Okay, so few classes I have left forgot to discuss about alpha 2 agonist. Alpha 2 agonist. So as you know that alpha 2 is act as a autoreceptor. Okay, it is or act as a autoreceptor. So it is basically act as a brake. So alpha 2 agonist drugs are clonidine and alpha methyl dopa. This is basically alpha methyl dopa is converted to alpha methyl norepinephrine. It is a prodrug. It converted to alpha methyl norepinephrine and it activates the alpha 2 agonist. Due to the activation of alpha 2 agonist, uh, so the release of the neurotransmitter is decreased. Okay, so major problem with this class of the drug is rebound hypertension. What is that? Rebound hypertension. What does it mean? Because whenever you stop taking this drug, mass release of neurotransmitter will take place at the synapse. That will cause rebound hypertension. This is the major side effect. So with the relationship, if we talk about in detail about clonidine, so clonidine will associated with withdrawal reaction. Okay, clonidine, so withdrawal reaction, and due to their acting on alpha 2 activity, alpha 2 agonistically, so sedation is a one of the important problem. So you will find sedation as a typical side effect associated with this class of the drug. Okay, so other than that, we also forgot to discuss about this class of the drug, this sympathetic nerve stimulators like reserpine, guanethidine and class of the drug. So these class of the drug like reserpine and class of the drug basically inhibits the vascular reuptake of neurotransmitter. So reserpine is act by inhibiting, we are talking about reserpine, okay, vascular reuptake of neurotransmitter. When the reuptake of neurotransmitter will inhibit, it will available more in synapse. So there are two enzymes, COMT catechol-O-methyl transferase and MAO monoamino oxidase. So these two enzymes will degrade this neurotransmitter and it inactivate the neurotransmitter molecule. So that's all about the drugs that used in the treatment of hypertension. I hope you will got all the point. Thank you.